This hemodialysis patient, through left brachioaxillary arteriovenous graft, he had history of previous pseudoaneurysm treated with stent, today presented with high venous pressure and face swelling. The brachial artery at mid upper arm is patent with low resistance wave flow. Pre to the anastomosis also still patent, and post to the anastomosis it is patent. Left brachioaxillary graft arterial anastomosis seen at elbow level. Actually, velocity elevated at the arterial anastomosis, 510 centimeter per second, with peak systolic velocity ratio of 2.3, suggesting moderate stenosis. Near to the anastomosis, near to arterial anastomosis, the graft it is patent with good flow. Graft above to the elbow, it show a big leak with pseudoaneurysm. Actually, this degenerative change, it happened due to puncture. At above elbow, we have this pseudoaneurysm. At mid upper arm, we can see we have this stent. As we are going from distal to proximal, we have this stent. And as I mentioned, this patient, he have previous history of pseudoaneurysm somewhere here and treated by this stent before 2 years. So today the stent is patent with good flow. We follow the stent till the proximal end. Now we measure the flow volume, and actually it was good. It is 1050 ml per minute. At venous anastomosis, again we have narrowing with aliasing. The peak systolic velocity elevated to 500 centimeter per second, with peak systolic velocity ratio 2.6, which suggesting moderate stenosis at the venous anastomosis. The axillary vein, it was patent and somehow with low flow, 75. Also the subclavian vein show low flow, only 34 centimeter per second. The brachiocephalic vein also show low flow and almost monophasic flow, only 33 centimeter per second. And we have multiple collateral at the neck and shoulder level. All this finding, the low flow at the central vein, at the subclavian vein, and the brachiocephalic vein, and all this collateral, it will suggest proximal obstruction, either severe stenosis or occlusion in the proximal brachiocephalic vein or in the superior vena cava. So the left brachioaxillary arteriovenous graft is patent with good flow. Hemodynamically, we have moderate stenosis at the arterial and venous anastomosis, with pseudoaneurysm seen at above elbow, and in addition to Doppler findings that are suggesting obstruction in proximal brachiocephalic vein or superior vena cava.